Please tell me why you think it is appropriate to charge Americans 9 times more for the same exact product that you sell in Germany. And by the way, correct me if I am wrong here, but I assume that when you sell Ozempic for $59 a month in Germany, you are making a profit there. Am I correct on that?
So, Senator, let me start by acknowledging and sharing your wish to have affordable medicines for Americans. And there's been a number of numbers mentioned here, and I think it's important to say that these are not comparable data. When I mentioned that it's really, really important for us to secure access to patients and affordability, we are hard at work in making sure that patients have access via the insurance schemes. And today, 80% of all Americans with insurance have access to these medicines at $25 or less for a month's supply. So it's a price point at the pharmacy counter we have to talk about.
Let me just interrupt you if I might. Okay, you're correct that many people pay $25 a month for Ozempic, but what you're forgetting to mention is that many of those people are paying outrageously high prices for the insurance that covers Ozempic and other drugs. So simply this is a pass-through to the insurance companies. Bottom line is you are charging the American people substantially more for the same exact drug than you are charging people in other countries. And my question is, why?
So, Senator, I appreciate the question. Let me try to explain how I see it. We launched Ozempic in 2018. We have had it on the market for some years. During those years, our price has declined by 40%. I mentioned that patients with insurance have access to the $25 or less for 80% of the cases. And if you look in this period in Medicare where there's broad coverage, premiums have not gone up. In the same period, the insurance companies and their PBMs, the big conglomerate of legal entities they have more than doubled, actually close to tripled their profit. So the fact that we can actually secure that 99% of people with insurance have access, that there's a copay at the pharmacy of $25 or less without premiums going up in Medicare, while profit goes up for the middlemen, I think is a concerning data point.
Well, I would simply say that most Americans would be surprised to learn that insurance rates are not going up. In my state, they're going up by 14%. But once again, you are not answering my question. The issue that we are discussing this morning is not complicated. It has everything to do with the chart behind me, which shows that Novo Nordisk's diabetes drug, Ozempic, is sold in Canada for $155, in Denmark for $122, in France for $71, and in Germany for $59. In the United States, Novo Nordisk charges us $969, over 15 times more than they sell that product in Germany. Wegovy, Novo Nordisk's weight loss drug, is even more expensive. As the chart behind me also shows, Wegovy is sold for $265 in Canada, $186 in Denmark, $137 in Germany, and $92 in the United Kingdom. In the US, the list price for Wegovy is $1,349 a month, nearly 15 times as much as it costs in the United Kingdom. What we are dealing with today is not just an issue of economics. It is not just an issue of corporate greed. It is a profound moral issue. Novo Nordisk has developed game-changing drugs which, if made affordable, can save the lives of tens of thousands of Americans every year. and significantly improve the quality of life of millions more, if made affordable. If not made affordable, Americans throughout this country will needlessly die and suffer. As representatives of the American people, we cannot allow that to happen. And let's be clear, the outrageously high cost of Ozempic, Wegovy, and other prescription drugs is directly related to the broken, dysfunctional, and cruel healthcare system in our country. While the current system makes huge profits for large drug companies like Novo Nordisk, huge profits for insurance companies, and huge profits for PBMs, it is failing the needs of ordinary Americans. In the United States today, we spend almost twice as much per capita on health care as the people of any other country. Nearly $13,500 for every man, woman, and child, over 17% of our GDP. Yet, despite this huge and unsustainable expenditure, we are the only major country on earth not to guarantee health care to all people as a human right. Further, despite all of that spending, our health care outcomes are not particularly good. Today, over 85 million Americans are uninsured or underinsured. Over 60,000 die each year because they don't get to a doctor when they should, and our life expectancy, which is actually declining in many parts of the country, is far below most other wealthy countries. So, what does all of this have to do with Mr. Jorgensen, Novo Nordisk, and our hearing today? A lot. The simple truth is that we pay by far the highest prices in the world for prescription drugs, and that is a major factor in the healthcare crisis we experience. How does that happen? What's the connection? First, 1 out of 4 Americans are unable to afford the prescription drugs that their doctors prescribe. Insanely, that means that millions of Americans go without the treatment that their doctors recommend. The result, some will actually die and others will become much sicker than they should. And millions will unnecessarily end up in emergency rooms or hospitals at great expense to our healthcare system. How crazy is that? Second, one of the reasons that hospital costs, it's not just prescription drugs, hospital costs in this country are rapidly rising, has to do with the very high cost of prescription drugs. In my hospital in Burlington, Vermont, CEO there tells me that 20% of his budget goes to the high cost of prescription drugs. And there are treatments now that cost hundreds of thousands of dollars a year. Third, a significant reason for the high cost of insurance policies. If you're upset out there that you're paying very high amounts of money for your insurance, has to do to a significant degree with the high cost of prescription drugs. Yes, millions of Americans with decent health insurance pay minimal amounts for their prescription drugs. That's the good news. The bad news is that they are paying a fortune in premiums, deductibles, and co-payments for the insurance that covers those drugs. I should also add that if you're a taxpayer in this country, you're paying higher taxes than you should because of the inflated costs that Medicare, Medicaid, and other public health programs pay for prescription drugs. Now, that is the overview and why the issue that we're discussing today is so important. It impacts every aspect of our healthcare system, the federal budget, private insurance. Now, let's get to the particulars with regard to Novo Nordisk, Ozempic, and Wegovy. Ozempic and Wegovy are different brand names for the same drug, semaglutide. These drugs are transformative new treatments for diabetes and obesity that help people control their blood sugar and lose weight. Both are manufactured by Novo Nordisk, and both are on track to be some of the best-selling and most profitable drugs in the history of the pharmaceutical industry. In fact, since 2018, Novo Nordisk has made nearly $50 billion in sales off of these two drugs. Importantly, for members of this committee, 72% of that revenue comes from sales in the United States of America. In other words, the United States is Novo Nordisk's cash cow for Ozempic and Wegovy. And given that these drugs will need to be taken over the course of a lifetime, it's not a one-time drug, you take it for your whole life, Novo Nordisk can expect to receive tens of billions in sales and huge profits from these drugs year after year after year. Now, why does Novo Nordisk charge the American people such outrageously high prices for Ozempic and Wegovy? Are they acting illegally by charging us such high prices? Are they violating the law? No, they're not. What they're doing is perfectly lawful. They are simply taking advantage of the fact that, until very recently, the United States has been the only major country on earth not to negotiate the cost of prescription drugs. In other words, Novo Nordisk and other drug companies, not just Novo Nordisk, can charge us as much as the market can bear. And that is precisely what they are doing. Now, in a few minutes, when Mr. Jorgensen makes his presentation, and we look forward to hearing from him, I suspect that he will tell us that the healthcare system here in the United States is complex, and that there is a difference between the list price and the net price as a result of the rebates that PBMs receive. And this committee has begun to do some serious work with regard to PBMs. And if he says that, he is correct. But even factoring in all of the rebates that PBMs receive, the net price for Ozempic is still nearly $600, over 9 times as much as it costs in Germany. And the estimated net price of Wegovy is over $800, nearly 4.5 times as much as it costs in Denmark. What must also be understood is that not everybody can take advantage of the net price of these drugs. If you are uninsured, you pay the full list price. If you have a large deductible, you pay the full list price. If you have co-insurance, the percentage of the price you pay at the pharmacy counter is based on the list price. And let's be clear, 75% of Americans, over 190 million people with insurance, are unable to access Wegovy through their insurance policies. Mr. Jorgensen may also tell us that Novo Nordisk is afraid that if it substantially reduced the list price for Ozempic and Wegovy, PBMs may limit coverage for these drugs. Well, Mr. Jorgensen, let me ease your concerns. I am delighted to announce today that I have received commitments in writing from all of the major PBMs that if Novo Nordisk substantially reduced the list price for Ozempic and Wegovy, they would not limit coverage. In fact, all of them told me they would be able to expand coverage for these drugs if the list price was reduced. I ask unanimous consent to insert the letters I received from the PBMs making this commitment into the record. Now, let me share with the committee some other important information that we have uncovered as part of our investigation. Last week, I received a letter from over 250 doctors urging us to do everything that we can to substantially lower the price of these drugs. This should come as no surprise. What these doctors are telling us is that if the price of Ozempic and Wegovy is not substantially reduced, many of their patients who have diabetes and obesity, especially lower-income Americans, often minority Americans, will be unable to afford these drugs. Some of these people, some of these patients will unnecessarily die, and others will suffer a significant decline in their quality of life. I ask unanimous consent to enter that letter into the record. Earlier this year, Dr. Alison Galvani, an epidemiologist at Yale University, conducted a study on Wegovy. And what she found, and I hope Mr. Jorgensen pays attention to this, is that over 40,000 lives a year could be saved if Wegovy were made widely available at an affordable price to Americans who need the drug. 40,000 lives. I ask unanimous consent to insert that study into the record. A few months ago, Dr. Melissa Barber, a healthcare economist at Yale University, conducted a study on the cost of manufacturing Ozempic. And what she found is that Ozempic can be profitably manufactured for less than $5 a month. We all know the cost of production is not the only expense by far for a drug company. Pharmaceutical companies spend great sums of money on research and development to find new treatments, with many of these products not coming to market. We all understand that. But it is important to know that this drug can be manufactured profitably for a few dollars a month. We may hear from Mr. Jorgensen that Novo Nordisk spent $21 billion on research and development since 2018, and I take his word on that. What he may not tell you is that Novo Nordisk spent $44 billion on stock buybacks and dividends over that same time period. In other words, since Ozempic came onto the market in 2018, Novo Nordisk spent over twice as much on stock buybacks and dividends that it spent on research and development. And let's be clear. Outrage over the high cost of Ozempic and other prescription drugs is not a partisan political issue, as I expect every person on this committee understands. It's not a Democratic issue. It's not a Republican issue. I'm an independent, not an independent issue. The vast majority of the American people are sick and tired of paying outrageously high prices for prescription drugs. For example, Dale Folwell, the Republican treasurer of the state of North Carolina, has told us that if he did not discontinue covering Wegovy for some 20,000 state workers in North Carolina, he would have been forced to double health insurance premiums for teachers, firefighters, and police officers in his state, regardless if they needed this drug or not. He would have had to double health insurance premiums in North Carolina. Blue Cross Blue Shield of Michigan also announced that it would have to discontinue covering Wegovy because it was too expensive. And when we talk about differing political views, I will tell you that Elon Musk, not one of my great political allies, recently posted on Twitter, and I quote, "Solving obesity greatly reduces risk of other diseases, especially diabetes, and improves quality of life. We do need to find a way to make appetite inhibitors available to anyone who wants them," end of quote. And Mr. Musk is right. Further, not only must we be concerned about lack of access to these drugs, we have also got to take a serious look at the financial implications of what happens if the prices of these drugs are not substantially reduced. Bottom line, if just half of the adults in our country with obesity took weight loss drugs like Wegovy at current prices, the cost would be astronomical and would have a devastating financial impact on our country and on federal and state budgets. Best estimate that I have seen suggests that if half the adults in our country took these weight loss drugs, it would cost $411 billion a year. $411 billion, and that is more than what Americans spent on all prescription drugs at the pharmacy counter in 2020 or 2022. In other words, the outrageously high prices of these drugs could bankrupt Medicare and radically increase premiums to absolutely unaffordable rates. This does not have to happen. It does not have to happen. Over the last several months, I and my staff have been talking to a number of major generic pharmaceutical companies. These are large companies that supply hundreds of millions of prescriptions to many millions of Americans, and what these CEOs have told me is of enormous consequence. They have studied the matter, and they have told me that they can sell a generic version of Ozempic, the exact same drug that Novo Nordisk is manufacturing, to Americans for less than $100 a month. $100 a month. Novo Nordisk charges us $969 a month for Ozempic. These generics can sell it to us for less than $100. Let's be clear. Nobody here is asking Novo Nordisk to provide charity to the American people. Novo Nordisk has already made billions of dollars in profit off of these products, and in the coming years will make billions more. All we are saying, Mr. Jorgensen, is treat the American people the same way that you treat people all over the world. Stop ripping us off. A few months ago, President Biden and I wrote an op-ed which appeared in USA Today, and here's what the President and I said, quote, "If Novo Nordisk and other pharmaceutical companies refuse to substantially lower prescription drug prices in our country and end their greed, we will do everything within our power to end it for them. Novo Nordisk must substantially reduce the price of Ozempic and Wegovy. As Americans, we must not rest until every person in our country can afford the prescription drugs they need to lead healthy, happy, and productive lives," end quote, from the op-ed from the President and myself. That's what President Biden and I wrote a few months ago, and that's what I believe. Prescription drugs in this country must be affordable, and we must not be forced to pay far higher prices than people in other countries for the same exact product. This is especially true when we face a national emergency in terms of the twin epidemics of diabetes and obesity, which, if not addressed with lower-cost drugs, could cost us tens of thousands of lives and an unimaginable amount of money. Congress and the administration have a moral responsibility to act now, act boldly, and to protect the American people.
Ranking Member Cassidy, Senators, thank you for the opportunity to speak again before the Health, Education, Labor and Pension Committee on behalf of Novo Nordisk. Last year, I was asked to testify about patients living with diabetes and insulin affordability. This year, I volunteered to appear before the Committee on Policy Solutions for Patients Living with Obesity and the challenges they face navigating the complex US healthcare system. I appreciate the opportunity to engage here today. For decades, our public discourse about obesity and to some extent type 2 diabetes was based on misinformation and blame. These conditions were treated as a personal choice, a failure of willpower. No one was talking about how these are chronic diseases and treatable diseases. With the discovery of semaglutide and the development of Ozempic and Wegovy, our collective understanding of these diseases fundamentally changed. But this shift was not a foregone conclusion. This was a long and winding road. Today, we can provide insulin to nearly 30 million patients. But patients living with type 2 diabetes and obesity can't wait another 50 years. That is why, since the beginning of last year, we have committed over $30 billion to expand manufacturing capacity. To put the $30 billion in perspective, this is 20% more than the entire US space program. It's also 4 times the amount that Congress has set aside for National Electrical Vehicle Charging Network. Our commitment includes $4 billion in new investments to expand our facility in North Carolina, on top of the $5 billion we have already invested there, creating thousands of construction jobs and manufacturing jobs in the state. We spend these resources because we can't afford not to. Type 2 diabetes costs US approximately $413 billion every year, and obesity costs the US $1.7 trillion. And we all know the physical and emotional toll these diseases make. You have said that our amazing medicines can't help patients if they can't afford them. That is true. It is also true that the full value of Ozempic and Wegovy can only be realized if patients can access them.
It's a very simple question. In Germany, they're paying $59 for Ozempic. In the United States, we pay $969. And again, even with all of the discounts, we are still paying very substantially more than the people of any other country. And you are selling, as I understand, that 72% of your revenue comes from the United States. Is that right? Roughly?
If it's based on our accounts, you're right. I don't have the number from the top of my head.
So you're making huge amounts of money in this country and you're charging us far more. And you haven't given me an answer as to why. Let me ask you another question. A recent study from Yale University has estimated, as I mentioned earlier, that 40,000 lives in America could be saved each and every year if Novo Nordisk substantially reduced the price of Wegovy and made it available to everyone who needs this drug at an affordable price. from a moral perspective, does it bother you knowing that keeping the price of Ozempic and Wegovy so high in the United States could lead to the preventable deaths of tens of thousands of Americans?
So, Senator, we are very committed to make sure that Americans have access at affordable price point for our medicines. There is no thing we would rather see happen. We have just announced 30 billion investments to increase capacity to serve these patients. There is a market we have to operate in, and we negotiate hard to make sure that Americans have access. We negotiate against the PBMs and give them significant rebate discounts and fees.
Mr. Jorgensen, you're not answering the question. And look, as you may know, I'm a great respecter of the people of Denmark. I think you have a social system which is very progressive. But I'm asking you a simple question as a decent human being. What studies tell us is that because of the very high price of your products, 40,000 people a year may die in America. And you have not. The increased production is fine. But what I am asking you is, if you don't act, 40,000 people a year could die. Is this acceptable to you?
Senator, any prospects of patients not getting access to the medicine they need, I think is terrifying. And we have to solve this challenge together. I mentioned in my opening that I don't think any one company can solve that alone. I wish there were more at the table today so we could have a discussion about how we do that together. We don't decide the price for patients. That's set by the insurance companies. I do acknowledge that there are patients who have poor insurance or no insurance. And if you, in the US, do not have insurance, if you have a low income, we actually have support programs to help those patients. I'm proud about those, but they are not a real solution, because patients should have access to medicines via insurance, because if you live with a chronic disease like type 2 diabetes or obesity, these are complex diseases that requires access to physicians. There are comorbidities you need to have treatment for. I strongly believe we need to solve this within insurance. And when you are in insurance, there is access to our medicine.
Well, Mr. Jorgensen, this committee has heard from insurance companies. We've heard from PBMs. We've heard from everybody in the world, and everyone blames everybody else. But you still have not answered my question. It's a very simple question. Why Novo Nordisk is charging Americans substantially higher prices for these drugs than the people in other countries. Let me get to another issue. Mr. Jorgensen, you have told this committee that you are concerned that if you substantially lowered the list prices of Ozempic and Wegovy in the United States, PBMs may take these drugs off of their formularies and deny access to patients who need these drugs. I think you used insulin as an example of that. However, I have received commitments in writing from the major PBMs that if Novo Nordisk lowered its list price, they would not limit access to Ozempic and Wegovy and would not take these drugs off of their formularies. Given this fact, will you commit today that Novo Nordisk will substantially reduce the list price of these drugs in the United States so that the American people are not paying higher prices, far higher prices, for these drugs than the people in Europe and Canada?
So thank you, Senator, for that information. That's new information for me. Anything that will help patients get access to affordable medicine, we'll be happy to look into. I'd just like to make a comment also that the experience, as you also allude to yourself, from insulin is one of when we had a discussion last year in the hearing on insulin, we actually lowered insulin pricing. That had a consequence. So when we dropped some of the insulin prices, we had our products dropped from formulary coverage. So less patients got access to those insulins. So I have a bit of concern how this could play out. But anything that can help patients get access to the medicines they need at affordable price point, we'll be happy to collaborate around that.
Are you prepared to have Novo Nordisk sit down with the PBMs who have made that commitment to me that they will not take your products off of the formulary, sit in a room with us and work on an agreement?
I'll be happy to, as I said, do anything that helps patients. And I don't know under which conditions such a promise comes. I haven't seen any of that.
Okay, I will get you they're in writing, and I'll get you the letters.
The fact that we do the R&D, why don't you charge them more to where there's at least not a 10-to-1 differential, to where you share the costs across the world, not put it on the burden of a place that's now borrowing 30 cents on every dollar for whatever's provided through government, and to where you're jabbing it through the private insurance side. Why is there that kind of difference? Why don't you charge them more in Europe?
So, Senator, we might also do that in the future, but actually the price differential you mentioned is not the real price differential. I think that's part of the problem, that we are not charging as much in the U.S. as you...
I think you're hiding behind your opaqueness, and you need to promote transparency for your own good. It'd be easier to understand. Thank you, Mr. Chairman.
Thank you, Senator Braun, and thank you, Mr. Jorgensen. Let me just make a few remarks. Senator Braun and I come from different perspectives, but occasionally we agree that the system is broken. Senator Braun said the industry is screwed up. Is that the correct quote? I don't agree that it's screwed up. It's enormously profitable. This is a company that makes huge profits. Top 10 pharmaceutical companies made over $100 billion in profit last year. It's not screwed up. They are making huge amounts of money. And I think, Mr. Jorgensen, you were not quite correct when you talk about 79% rebates on Ozempic and Wegovy. That may be in general. My understanding, it's a 40% rebate. I believe that I have heard that in fact, the product, that after all of the rebates from the PBMs, your product is about, for Ozempic, about $600.
Can I clarify that?
Please.
So our price has gone down by 40% since launch, and already when we launched it, there was a significant rebate. So the rebate has gone up by 40% since launch, on top of a launch rebate.
All right. My understanding is that factoring in, and we all agree it is a complicated and broken system, I would point out, and you correct me if I'm wrong, Mr. Jorgensen, that in your beautiful country, Denmark, anybody can walk into a doctor's office, go to the hospital. How much do they pay out of pocket?
In Denmark, we have, say, a healthcare system that's tax paid.
Yes. How much does an individual pay out of, if I'm in the hospital in 2 weeks in Denmark, how much do I pay out of pocket?
To go to the hospital?
Yeah.
Zero.
Zero. You go to any doctor? Zero. And you are spending a little bit more than half as much per capita as we are. So they provide quality care for all of your people, and almost half of what we do. All right. That's a simple system that, to my mind, makes sense. We have a complicated system, not only in healthcare, but in prescription drugs as well. But the point that I want to make is that factoring in all of the rebates, we heard a lot about rebates, I agree with much of the criticism, factoring in all of the rebates that PBMs receive, the net price of Ozempic is still nearly $600, over 9 times as much as it costs in Germany. And the estimated net price of Wegovy is over $800, nearly 4.5 times as much as it costs in Denmark. And I know Senator Romney, others said, well, how is that so? Why is it so much less expensive in Europe? And the answer is obvious. In the United States of America, we are the only major country on earth that has not negotiated prices. So you can charge us any price that you want. Other drug companies can charge us any price that they want, as much as the market will bear, and that's what you do. Understandably, you charge us far more than other countries because they negotiate and regulate prices. Now, the good news, and I share the concerns and the skepticism about PBMs, but we have, as I've mentioned to you and will share with you, statements from the 3 major PBMs that they would not penalize Novo Nordisk in terms of formula placement if you substantially lowered list prices. And I look forward to sitting down with you, your representatives, and the three PBMs to make sure that that happens.